These are the case studies for chapters 21 and 22. We're going to start with edema and heart failure. George, a 97-year-old man, goes to see his doctor with ankle swelling, which is edema, and tiredness. Edema is fluid-filled accumulation in the interstitial space. The doctor examines George and diagnoses heart failure. George's heart failure is resulting in the congestion of the venous system with excess blood. So describe the structure of a capillary wall. So the capillary wall is approximately 0.2 micrometers, which is 0.02 millimeters thick, and it has two layers. It has a basement membrane and an endothelium. The endothelium in continuous capillaries will allow certain things across it. If it's a fenestrated capillary, there's pores or gaps, and that will allow even more things across it at a faster rate. And so water can pass down pressure gradient in both continuous capillaries and in fenestrated capillaries. Number 2, what is a capillary exchange and what factors are involved in the process? Capillary exchange is the movement of a substance between the capillary and the interstitial fluid. Capillary exchange is driven by the flow of blood through the capillaries and by diffusion or bulk flow, which is reabsorption and filtration, or by vesicular transport, as well as active transport. Number 3, what do the terms filtration and reabsorption mean? Filtration is the net outward movement of fluid from the capillary into the interstitial fluid, and reabsorption is a net inward movement of fluid from the interstitial fluid into the capillary. Number 4, what two main factors influence the net exchange, meaning the net filtration across the capillary wall? Hydrostatic pressure and colloid osmotic pressure, which is due to the plasma proteins in the blood vessel, will both influence the movement of fluid across a capillary wall. Number 5, how would you calculate the net filtration pressure in a capillary bed? The net filtration pressure equals the outward pressure minus the inward pressure. So, in other words, the net filtration pressure equals the blood hydrostatic pressure plus the interstitial fluid osmotic pressure minus the blood osmotic pressure plus the interstitial fluid hydrostatic pressure. Now, we have been saying, however, that the interstitial fluid osmotic pressure and the interstitial hydrostatic pressure is near zero. So basically, the net filtration pressure is the blood hydrostatic pressure minus the blood colloid osmotic pressure. Only in specific pathologies would we need to look at the interstitial fluid osmotic pressure or the interstitial hydrostatic pressure. Number 6, what effect would the buildup of blood in George's veins have on the pressure in his capillary bed? So, an increased congestion of blood in the veins would lead to a backup of blood into the capillaries, and this would lead to an increase in the hydrostatic pressure in the veins and the capillaries. Number 7, how does your answer to question 6 help to explain George's ankle swelling? George is started on a drug that will increase the contractility of his heart muscle and one that will help to reduce the amount of fluid in his body. So an increase in capillary pressure will lead to a greater outward pressure and therefore increase the filtration and reduce the absorption of fluid into the capillary. This leads to an increase in filtration pressure and an increase in the amount of fluid in the interstitial fluid. This presents itself as swelling or edema, which is oftentimes seen in the ankles, as the ankles are more of a gravity-dependent region. Number 8, what effect does the sympathetic nervous system have on the contractility of heart muscle, and which receptors are involved in bringing about this effect, and what does their activation achieve. So the sympathetic nervous system has a positive ionotropic effect on the contractile cells of the heart. This means that the sympathetic activity will increase the contractility of cardiac muscle. Norepinephrine acts on the beta 1 receptors to increase calcium inflow through the voltage-gated calcium channels, and this allows increased levels of calcium to enter the cells and therefore increase the contractility. Number 9, what type of drug could you therefore give George to help increase the contractility of his heart muscle, and which receptor would be activated? So George could be given a drug that mimics the action of the sympathetic nervous system. A beta 1 receptor agonist would have that desired effect. So some examples of beta 1 receptor agonists are dopamine and dobutamine. The second case study is about the Co-Arctation of the aorta. Miles, a 4-year-old boy, has a Co-Arctation, which is a narrowing of his aortic arch, just distal to the ligamentum arteriosum. In order to view the narrowing, doctors injected a contrast dye into Miles' blood and then took an X-ray image of his thorax. This enabled them to visualize his aorta and its branches. Number 10. Starting at the heart and ending at the point of termination, name the different parts of the aorta. So starting at the heart, the parts of the aorta are the ascending aorta, the arch of the aorta, the descending thoracic aorta, and the abdominal aorta. Number 11. Excluding the vessels supplying the heart, what are the first 3 main branches arising from the aorta in the superior mediastinum, and what do these blood vessels supply? So the 3 main branches are the brachiocephalic trunk on the right, the left common carotid artery, and the left subclavian artery. These branches supply the head, neck, brain, upper limbs, and some of the thoracic wall, the associated muscles, and the breast tissue. Number 12. Name the branches of the aorta as it travels down through the thorax. State what these branches supply. So in the thorax, the aorta gives off the bronchial arteries, which supply the bronchial tree, the esophageal arteries, which supply the esophagus, the posterior intercostal arteries, which supply the intercostal spaces, and the subcostal artery, which supplies the tissue of and just below the 12th rib. Number 13. What does the part of the aorta inferior to the diaphragm supply? Inferior to the diaphragm, the aorta supplies the abdominal organs, for example, the GI tract, the liver, the pancreas, and the spleen, as well as pelvic organs, for example, bladder, uterus, rectum, and vagina, and also the perineum, for example, the external genitalia and anal canal, as well as the abdominal and pelvic walls and the gluteal region and the lower limbs. Number 14. At what vertebral level does the aorta terminate? What does it branch into at the point of termination? So the aorta terminates at around the level of L4, and then it branches into the left and right common iliac arteries. Number 15. What is the ligamentum arteriosum? The ligamentum arteriosum is a fibrous remnant of the ductus arteriosus, which is a small vessel that permits the shunting of blood from the pulmonary trunk to the aorta in the developing embryo and fetus. Question number 16. To which part of the aorta is the ligamentum arteriosum attached? The ligamentum arteriosum is attached to the aortic arch. Number 17. What will happen to Miles' blood pressure proximal to the narrowing and distal to the narrowing? Miles' blood pressure proximal to the narrowing will be increased because the blood is backing up. And distal to the narrowing, it will be decreased because the aorta distal to the narrowing won't be receiving as much blood. Number 18, What might you notice when examining and comparing the pulse at Miles's wrist, which is the radial artery, to the pulse in his groin, which is the femoral artery? The narrowing might cause the pulse in Miles' lower limbs, like the femoral artery, to be weaker than that in his upper limbs or in the radial artery. This is because the branch for the radial artery is before the narrowing of the aorta, whereas the femoral branch is after the narrowing. This might also mean that the lower limb pulses might be felt after you feel the upper limb pulses. This is known as a radiofemoral delay. Number 19, what problems or symptoms might a narrowing of the aorta distal to the ligamentum arteriosum cause? Well, the narrowing could reduce blood flow to structures supplied by that descending thoracic aorta and by the abdominal aorta. Miles may have a reduced blood supply to his body wall, to his GI tract, and to his lower limbs. This could lead to cold skin, limb pain on exercise, and problems associated with blood flow to the GI tract. The next case study is on innate immunity. Madea, a 3-day-old baby girl, was about to be taken home by her mother. Her mother was worried that Madea would be susceptible to infections, as she had been told that her baby would not have an adaptive immune system. The doctor explained that Madea's innate immune system would help to protect her from many pathogens. The doctor also said that the first sign of an infection in Madea would most likely be a fever. Question number 20, what is the function of the innate immune system? The innate immune system forms the body's first and second lines of defense against infection and inflammation. Innate immunity is nonspecific, and it's directed against all foreign matter. 21. Name the two main structures that form the body's mechanical first line of defense. Well, the skin and mucous membranes form the body's first line of mechanical defense. 22. Describe the chemical defenses that protect the eyes and vagina against infection. The eyes secrete tears, which contain lysozymes that can destroy bacteria. The vaginal mucous membrane secretes acidic mucus, which discourages the growth of bacteria and yeast. Number 23. What 5 substances, cells, or events make up the body's second line of defense? The body's second line of defense consists of antimicrobial substances that the cells secrete, phagocytes, natural killer cells, inflammation, and fever. Number 24, what are the 4 main antimicrobial substances that form part of the second line of defense? The antimicrobial substances forming the second line of defense consist of interferon, the complement system, iron-binding proteins, and antimicrobial proteins. 25. What are the roles of the substances named in answer to question 24? The 4 main antimicrobial substances that form the second line of defense are 1. Interferons that prevent the replication of viruses. 2. The complement system that, when activated, causes a lysis of infected cells and promotes inflammation and microbial phagocytosis. Number 3, the iron-binding proteins reduce the amount of iron available to the bacteria, which bacteria need to be able to replicate. And 4, the antimicrobial proteins kill the microbes and attract other immune cells. So some of these I understand that you are not familiar with, but hopefully after watching this video and completing the case studies, then you are familiar with them. And number 26, why would Madea get a fever if she got an infection of her skin? In other words, explain what increases Madea's temperature and the purpose of this. Both bacteria and the immune system produce pyrogens. Pyrogens alter the set point temperature of the hypothalamus, causes blood vessels to contract, a person starts to shiver, and increase their metabolism, which increases heat. The fever that results acts to inhibit the microbial growth and help the immune system components, such as interferons, work more optimally. Our next case study is HIV infection. So Satnam, a 35-year-old engineer, went to see his doctor as he had a persistent dry cough and had been feeling ill and run down for over a month. His doctor examined him and found that he had a lung infection, shingles, which is a viral infection of an area of skin, and a yeast infection in his mouth. Further tests revealed that Satnam had human immunodeficiency virus, or HIV. Satnam had a very low CD4 count of 150. Satnam's lung was infected with Pneumocystis carinii, an opportunistic pathogen. So question number 27, what is CD4 and where is it found? CD4 is a protein that's found predominantly on the surface of CD4 T helper cells. CD4 is also found on the surface of macrophages. 28, what is the normal role of CD4? Helper T cells can bind to the MHC2 complex on the surface of antigen-presenting cells, or to B cells by the T cell receptor. CD4 proteins stabilize the binding between the T cell receptor and the antigen MHC2 complex. Such binding activates the T cell. Therefore, CD4 assists in the activation of the T cell. Binding of T cells to APCs, or antigen-presenting cells, via the TCR receptor, or T cell receptor, and CD4 protein releases interleukin-2. Interleukin-2 promotes the cloning of T cells and helps stimulate other cells of the immune system. Question 29. Why would a lack of cells with CD4 lead to Satnam getting more bacterial and viral infections, such as Pneumocystis carinii and shingles? So a reduction in the number of CD4 helper T cells would result in reduced T cell mediated immunity, therefore a reduced ability to mount an immune reaction. This adversely affects the ability of Satnam's T cell population to undergo cloning in response to foreign antigens. Therefore, he would have a reduced number of cytotoxic T cells and helper T cells. In turn, this would lead to reduced activation of B cells and a reduction in antibody production. Satnam will therefore be prone to infections from organisms that are not normally pathogenic, but are opportunistic, such as Pneumocystis carinii and shingles. Our last case study is on immunization. Jane, a 12-year-old girl, was receiving her immunization against the human papillomavirus, or HPV. The vaccination program is designed to protect females against HPV-related cervical and genital cancers. The HPV vaccine contains proteins from the human papillomavirus and virus-like particles that act as antigens. So number 30 is, what is an antigen? An antigen is an immunogenic substance that can trigger an immune response. So it's basically a protein that can trigger an immune response. 31, which cells will take up the HPV antigen following injection into Jane's arm? Antigen-presenting cells, or APCs, such as dendritic cells or macrophages or B cells, will take up the HPV antigens or engulf them within the extracellular space or fluid by phagocytosis or by endocytosis. 32. What will happen to the HPV antigen to enable it to activate Jane's T cells? Enzymes within the antigen-presenting cell split the HPV antigen into smaller peptide fragments. The APC will produce MHC2 proteins, which will bind to the peptide fragments, forming a vesicle. The vesicle containing the complexes then binds to the plasma membrane of the antigen-presenting cell, and the antigen complex is presented on the outer surface of the APC to the T cells. Dendritic cells will carry the HPV antigens from the site of infection to secondary lymphoid tissues like the lymph glands and the tonsils. And at these places, the antigens then would be presented to the T cells there. Number 33, what is an antibody? An antibody is an immunoglobulin, which is a protein produced by the B cells. The antibody is able to bind to specific antigens. Antibodies circulate throughout the body. There are 5 different classes of antibodies: IgA, IgD, IgE, IgG, and IgM, each of which has a different property and different functions. 34. What are the roles of antibodies? Antibodies bind to specific antigens. The binding of antibodies to antigens can have several different actions, including 1, they can neutralize the bacterial toxins, and they can prevent viral attachment to body cells. 2, they can block the flagella or cilia of bacteria, rendering them immobile. 3, they can bind to antigens at once, causing the antigens to clump together, a process known as agglutination. And this is the process that we're most familiar with. 4, they can initiate the classical pathway of the complement system. And 5, they can attract phagocytes to the antigen. Now, I know we didn't cover this in the lecture video. However, you will be covering this in microbiology, so I've left this question in. Question number 35. How are Jane's T cells and B cells involved in the immune response to the HPV antigen? Explain the role of each cell type and how antibody production is activated. Well, the helper T cells recognize the HPV antigen on the MHC complex that's presented on the surface of that antigen-presenting cell. Then the helper T cells become activated. The activated helper T cells secrete cytokines, such as interleukin-2, to stimulate the T cells to proliferate and clone. Activated helper T cells then can bind to and activate antigen-presenting B cells using the T cell receptor. This interaction releases interleukin-4 and 6, which cause the B cells to release IgM and undergo cloning. The cloning of these B cells leads to differentiation into plasma cells and memory B cells. The cloned plasma cells then produce antibodies to the HPV antigen. There can be a lag of a few days to weeks before antibodies are produced, and levels of IgM antibodies will initially rise, followed by a rise in levels of IgG antibodies. Antibody levels will eventually level off and fall once the antigen or infection has been cleared. Last question, question number 36. Explain how, following vaccination, Jane will remain immune to future infection with HPV. Following vaccination, Jane will have artificially acquired active immunity. During the immune response, memory cells are produced. Memory cells include helper T cells, cytotoxic T cells, and B cells. These cells remain in the body. If the antigen is encountered again, the secondary response is quicker, and the level of antibodies specific to HPV, IgG in particular, rises faster and higher than the initial response. The antibodies produced during the secondary response are more effective at combating the antigen and can defeat the infection before any symptoms develop. This ends our chapters 21 and 22 case studies.